Hello, I'm Tammy Riley, Public Health Director for the Pike County Health Department, and I have an important update for the public. First, I want to announce 6 new cases. We have for case number 54, we have a 44-year-old female who is asymptomatic. For case number 55, we have a 50-year-old male who is also asymptomatic. For case number 56, we have a 32-year-old male who is sick and recovering from home. For case number 57, we have an 82-year-old female, and she is hospitalized. For case number 58, we have a 28-year-old female, symptoms unknown. And for case number 59, we have a 44-year-old female, asymptomatic. One of the reasons I wanted to make a live public announcement, I have some very important information to update the Pike County citizens, in addition to the fact that within the last 24 hours, we've had 6 additional cases. As I've said in the recent past, many of these cases have epidemiological links to each other. They're related, or they've worked together, they've attended church together. So there's some sort of what we call epi-link. And going into the Memorial Day weekend, we had 28 cases. Currently, we have 59 cases. Quite a few of those cases are active. 3 of those cases are hospitalized. So as a public health official, the Pike County Health Department, and as the Public Health Director, I'm very concerned with these numbers. I also want to address some frequently asked questions. When I make an update on our website and on our social media page, there's frequent questions that occur over and over again. And so I want to take an opportunity to answer some of these questions. And also I have a couple of blanket statements to make in regards to businesses, organizations that have been impacted by COVID-19. One of the more frequently asked questions is, if someone is asymptomatic, in other words, they don't have symptoms, why were they tested? So there's a variety of reasons why individuals would test if they are asymptomatic, or in other words, have no symptoms. Number one would be out of an abundance of caution. Individuals are being good citizens if they're returning to work, if they're resuming life in some new way, if they've traveled. For a variety of reasons, out of an abundance of caution, Pike County citizens do their civic duty and they go get a test. Also, individuals may have suspected or even known that they've had exposure to another COVID-19 case. In that instance, of course, they would go get a test. Also, many times providers will request that their patients get a test as a pre-procedural process. So prior to a medical procedure, a provider sometimes asks our citizens to submit a test for COVID-19. So there's a variety of reasons why individuals who are asymptomatic test, and testing capacity has expanded, and we have a wide variety of avenues for testing. So I can look outside my window and see the Pikeville Medical Center drive-through test site, which is available Tuesday through Friday near their pharmacy. Many private providers provide testing as well. Another frequently asked question is, where are the cases? When I do an update, like today, we have 6 cases, male, female, ages, 28 through 82. So a variety of sexes, a variety of ages. Some are asymptomatic, some are very sick and in the hospital. But when I announce that, I am obligated as the health director to protect those individuals' privacy, and there's protected health information, and the HIPAA law that as public health officials we're required to be very sensitive to that, and I take that very seriously. But at the same time, I need to communicate to the public so that you understand the enormity of where we are. So there's a balance there for me. So if you have asked, and many of you have asked, where are the cases? Are they on my street? Are they in my neighborhood? My answer to you is emphatically this, that COVID-19 has impacted Pike County from one end to the other end. And in all likelihood, there has been a case either on your street or in your unique neighborhood community. So please assume that you live nearby or have been in close proximity to a positive COVID case. It is quite possible, and all of Pike County has been affected. So if you've asked that question, I'm answering you now. It has in all likelihood been in your community because it has affected the entire county from one end to the other. Now, last but not least, I'm going to make a couple of blanket statements about some organizations. For those individuals or parishioners or congregates who have attended the Lighthouse Apostolic Church in Feds Creek, Kentucky, from June 1st until today, the Pike County Health Department would request that you quarantine yourself for 14 days. Also, if you have any questions or concerns, please contact the Pike County Health Department at 509-5500, and we will give you guidance on testing and quarantining. That is the Lighthouse Apostolic Church in Feds Creek, Kentucky, from June 1st until today, June 19th. Second announcement, the Pike County Public Library in Phelps, Kentucky, that's located at 38575 State Highway 194 East. If you were a patron or an employee working there on June 16th, that was Tuesday, or yesterday, June 18th, you also need to quarantine. And please contact the Pike County Health Department, 509-5500, if you were in the Pike County Public Library in Phelps, Kentucky, June 16th or June 18th. So those are my main announcements. What I'm going to do now is introduce my friend, Dr. Fadi All-Across. He's the Infectious Disease Medical Director for Pikeville Medical Center. He is going to speak, and then we will take questions. Dr. Fadi.
All right. Thank you, Tammy. All right, good morning, everybody. So I'm trying to make like a scientific statement here, because we need to shed a light about COVID-19 and about the situation here in Kentucky, in our area, as well as in the nation. And we have to say that COVID-19 is going to linger for quite a bit of time. So whoever thinks this is gone, this is not reality. So it's going to stay for some time, and you have to be very cautious and very careful with everything you're doing. In these challenging times, when chaos has been unleashed, we need each other more than ever. And this is the time that we need to show solidarity, especially for the COVID-19 and for the other problems, to go over it and to bring our community together stronger than ever. We need to stay overly cautious and try to turn that COVID-19 eventuality into an opportunity to enjoy life. We need to sustain life. We don't want any rollback. We don't want any kind of lockdown. This is not the intention. We need to move forward. However, we need to do what's right for our area and for our nation. No such thing is called zero risk. We have to pay attention to that. And I went over a lot of videos emphasizing on the quality of risk, the quality of activities you're doing, and based on the activity, you're going to generate some sort of risk. So the decision about what's safe or not is going to be up to you. It's up to your decision. So we are allowing ourselves to move around communities and around states more freely. And by doing this, we're going to be in contact with more people. And by doing this, you're going to increase the chance of bringing COVID-19 to this area. In the past, we said multiple times that we are going to, our spike here in Pike County is going to be a little bit later than the rest of the nation, because we know that we are shielded by the mountains. And we know that, but opening life, we're gonna bring activity here, this area, and this is what's happening at this point. So we want to sustain reopening economy and life, and we need you to be part of the solution. We need you to stop the spread. And how to do that? There are certain things that you need to do. Number one, washing hands. This is very important. Number two, you need to maintain the social distancing because that physical separation continues to be a great weapon to stop the spread. And on top of that, wearing masks has been shown to be an effective tool to stop shedding the virus in the environment and subsequently contaminating that environment and causing infection. And in my opinion, wearing masks is an act of strength. This is not an act of weakness. Take it this way, because by putting the face mask on your face, it's gonna protect the others. And if you really care about the other, this is what you need to do, especially in confined places, in the public, and you need to protect each other. So this is the intention. We are not through COVID-19 outbreak yet, and we are currently in the second spike of the COVID-19 as borders has been opened up, as restrictions have been lifted, and we can see basically the number of cases has drastically increased. If you look at the numbers worldwide, 8.2 million people infected with COVID-19, with almost half a million people died because of the COVID-19. And in the United States, the situation is not that better. 2.2 million people positive for COVID-19, with over 120,000 deaths. And in Kentucky, we are reaching the 13,197 with 520 deaths. And in our Pike County, we have 59 positive cases, 2 mortality, and currently at PMC, we have 4 hospitalizations, 3 from Pike County and 1 from different counties. So we are seeing more hospitalization now, and this is slightly alarming because usually the number of hospitalization is gonna determine what's gonna be the gauge or what's gonna be the pace of reopening. Let me talk a little bit about how to win that game. If you want to win against that invisible virus, we need to move to the offense. And not only doing this, we need to maintain the defense. And I'm going to talk about these 2 aspects separately. So to enhance our offensive tactics, we need to maintain what's called the 4 corners of the safety box. What does it mean? We need to test more, including symptomatic and asymptomatic. And as Mrs. Riley said, asymptomatic patients can turn into symptomatic later on. We call them the pre-symptomatic. Some of them, they stay asymptomatic, but some of them, they can turn to be symptomatic, and subsequently, we need to widely test everybody to determine what's the activity here in this area. And that piece of information is so important to the public health, because if we know if you're positive, we can isolate the positive people, we can trace the contact, and we can quarantine basically these people. By doing this, we can contain the COVID-19 and block and hinder the spread to the community. On the other side, defensive measures are crucial, and that's why we talk about the 5 C's. And I'm gonna change one of the C to, instead of basically covering your face and nose with a mask is very important. Do your civic duty to protect yourself in the community. Cover your mouth and nose when you cough and sneeze, and as well as contain when you're sick. All these are great defensive tools because at this point we have no licensed medication, we have no licensed vaccine, and our mitigation measures are the only active weapons in our arsenal. So this is how we can contain, and this is how we can sustain life. So again, the goal of these meetings, and we do that frequently, to give you knowledge, to empower you with knowledge, because we need you to be a part of the solution. We need to empower you with this knowledge to do your part and help us to go over the COVID-19 and keep this area very safe. So I have mentioned multiple times that as we're going through phases in reopening, the activity of the virus is crucial to determine how we're going to gauge the pace. So anytime we'll see more activity is going to be a problem for us, because if we see more activity, it's going to limit us moving into these phases. And our intention in few days to go to 50 people individual gathering. So the question here, are we able to do that safely if we have that much activity? This is going to be definitely a question that we need to ask, and we need to make sure, is it safe to do that? But resuming economy and life and moving with scheduled phases are totally contingent to the volume of admission to the hospital. So we need to know exactly what's going to happen to the hospital, because we're going to go back to the point, are we able to sustain the healthcare system? Because anytime you bring the healthcare system sustainability is becoming an issue. The more you see patient coming to the hospital, the more you see patient mainly coming to the ICU, you know that you are heading south. You're not heading in the right direction. So again, I urge everyone, okay, the one going to the stores, the ones going to workplaces, the ones going to protest, and the ones going to election rally, please keep the 6-foot distance. Please keep the physical separation. Please wear mask. Please wash your hands. All these going to be very helpful to protect the community, to protect the nation, and resume life and sustain life. This is more important than resuming life, is to sustain life. We need to sustain life. Because again, there is no intention to go back. We don't want any lockdown. We don't want any rollback. We need to keep moving. And without you, we cannot do that. You are the MVP of the game. Without you, this is not going to work. Without your help, without you being part of that solution, it's not going to help. So again, all the path to resume life is going to be based on the activity, as well as the mitigation measures, as well as on the 4 corners of the safety box. So please be part of the solution. Mrs. Riley?
Thank you, Dr. Foddy, all across. Any questions? Anything?
Tammy, you talked about, where Dr. Foddy talked about opening up the economy. Can you talk a little bit about church gatherings? You mentioned that the people who attended this particular church should be, cautious and vigilant. Apparently, there were some cases that were out of that church.
Right.
And also, can you talk about, gatherings such as yard sales, flea markets,
Yes.
4th of July celebrations, parties,
Yes.
picnics, and public gatherings? Is the Pike County Health Department going to advise the city and the county to not have those things? And also talk about when we open up businesses like the larger department stores, are you still being vigilant on their social distancing and masks and so on? Okay,
that's quite a few questions. So I'll start, but it's in particular from a general perspective about gatherings. I'll address the church first. The particular church that I mentioned, there are 6 definite links and potentially 7 or 8, but 6 very firm direct links of our so out of our 59 cases, 6 come from that church. And so there was definitely an epi-link, and without having the list of all of the parishioners and everyone who had attended that church from June 1st moving forward, we felt that we could not protect and advise those individuals without making the blanket statement. But as we've said, and I'm going to reiterate much of what Dr. Foddy all across said, but we have I'll reiterate what he said, but we've said it from the beginning. It really is very simple, that 5C plan. It goes back to that, but there have been some yard sale activity that has concerned me. I don't understand the purpose of a 5, 6, 7 family yard sale with individuals crowding in to a small space area during these times. Normal times, of course, that is something that we did frequently during normal times, but these are not normal times, and we are seeing a spike, and I'm advising individuals, to refrain from such activity. Retail, yes, our environmentalists are going out. They have continued to do that from day one and advise the retail and others who have reopened, including churches, restaurants. Their capacity has expanded. So we have, and many of those, like restaurants, for example, those are industries that we've regulated. We've always regulated, so we're very familiar with those industries. But we've worked very closely with retail. And I do believe, I'd like to take an opportunity to say that almost all of the business owners have worked very well with us. They've gone above and beyond to try to protect their consumers. As Dr. Faudy said, the consumers, though, are our MVPs. That's who we're depending on to listen to us and to follow directions when they enter a place of business or a place of worship, to listen to the guidance that they're receiving, and remaining 6 feet apart of others, and wearing your mask when you're in a confined area where you cannot maintain that 6 feet. And then, what was your question at the end in regards to?
Flea markets and yard sales and stuff like
Yeah,
that.
it just goes to, you know, I would highly recommend to not do that.
Are
Save a
banned?
yard, I'm
Are
sorry?
they banned at this point, or are they wide open?
Yards, we have advised against yard sales. The health department has advised that Pike Countyans not do yard sales. Flea markets are allowed. Flea markets are allowed. So there's a fine line there. And so we just ask citizens to be cautious and to not engage in any activities that would encourage, you know, congregation where that 6 foot social distance would be nearly impossible or impossible.
Have you also met with the city of Pikeville and
The Fourth.
advised them about the 4th of July celebration, and what have they determined?
I've not had a formal sit-down meeting with anyone regarding the 4th of July activities. There has been some discussion, and I've had a phone call with the mayor from Coal Run, Andrew Scott, and discussed the Coal Run activities. And my understanding, and I've also had a verbal conversation with Philip Ellswick, the city manager for Pikeville. And my understanding is both organizations are planning on proceeding with their 4th of July. They've advertised their 4th of July fireworks only. The sale of food and other activities that normally go along with the fireworks will not take place, and they are encouraging their citizens to enjoy their fireworks from their automobiles. So that's my understanding. If there are any groups, those organizations are aware, per my direction, that, you know, after June 29th, of course, as long as we proceed as normal, there are groups of 50 or less allowed. So I have advised them of that guidance from the State Department of Public Health, and so they are aware, and we have discussed that.
With these new cases that were announced, I know you were asking, you're finding out contacts, you're trying to find out who they were in contact with. What's some of the other questions? Are you asking if they've worn masks? Is any admitted to not social distancing?
Yeah, absolutely. Those are the questions that we ask. And when I say we, the nurse administrator, Stephanie Bentley, and our regional epidemiologist, Morgan Peterson, works directly with those individuals. They do the interviewing, and then we as a team determine some decisions like blanket announcements and things of that nature. So we work together very closely as a team. But Stephanie and Morgan do those interviews. And yes, those are the questions that they ask. They do very thorough interviews to determine who their direct contacts were, if it was sustained interaction, and that is subjective to a large part, whether someone has had sustained interaction with another individual, and whether they meet the criteria for quarantine.
So I know you said the Phelps Library, so it's closed down. You're closing it down for 14 days. And what's the process with that? But also, I know the Pike County Library, the one here in Pikeville, sometimes people, they'll share books. Some employees travel back and forth.
We're working with those organizations. This is very new information as of yesterday, late evening, and we're working with them this morning. But their patrons and their employees have been notified, their patrons, and that's why I make a blanket announcement such as this, because sometimes you get in a situation where it is nearly impossible to contact all individuals who have maybe entered a place of business or such as the library. And so you make the blanket announcement in order to protect the public, so that anyone that maybe visited there on those 2 dates would contact us.
And this might be a question for Dr. Faudy,
Okay.
but just even with the cases, I know yesterday there was a case that was announced. It was a death in Perry County. and some people are getting confused with a COVID-19 related death. So explain a little bit about what that means for the people, but also what's the long-term effects that if a younger person gets COVID-19, how that can affect their body, their lungs later on in life.
Yeah, I'm gonna let Dr. Foddy answer that.
I think you're asking a very challenging question regarding that. So here, anytime you have a COVID-19 positive and you're in the hospital and you're in critical situation and any complication would happen, will attribute it mainly to the COVID-19 unless something else clearly showing up. So this is the way we do it now in our registry. So positive COVID-19, if you're in the ICU with lung damage and there is nothing else, this is gonna be the only explanation at this point. Now, the problem with COVID-19 has been fluid since the beginning, and we know that disease, majority of patients are gonna do well, 80-85%, 15-20% they're gonna do badly, and mainly the people who's gonna do badly are the people who are carrying comorbidities like obesity, diabetes, heart disease, lung disease, cancer, immunological problems. So all these patients are at high risk to have complications from the COVID-19. Now, the problem is sometimes even young people without any comorbidities, they suffer some sort of complications. And this has been disturbing because we cannot pick and choose who's gonna be the person who's gonna suffer complications. And that's the tricky part of the COVID-19. Now, there are many articles now published about what's gonna be after COVID-19 situation. COVID-19 will cause a disease in the lung called ARDS, acute respiratory distress syndrome. And now we have more data evolving showing this is not the typical one. This is a modified one. It's called the coronavirus ARDS. And that's why if you look at the new research analysis coming from UK, when they done a bunch of studies about therapeutic options, they found that dexamethasone could be an option for COVID-19. And in fact, if somebody in the ICU on mechanical ventilation, desperately ill, so dexamethasone showing efficacy in decreasing mortality by 35%, and this is not typically seen in the typical ARDS, because if you have ARDS, we don't give steroid. Now, coronavirus, it seems to be a little bit different than the ARDS, the typical ARDS. That's why the steroid is working, because we know that coronavirus, the novel one, will produce notorious amount of the interleukin and the TNF-alpha, and these are very bad inflammatory markers that go to the lung and create massive damage. On the top of that, we've seen data now showing that patients with COVID-19, they have some sort of clotting problem. So blood clotting in the lungs as well in the vessels that can also contribute to increasing complexity of the disease. So now, as data are emerging and as we know a little bit more about the COVID-19, now we're coming with at least some modified guidelines regarding the COVID-19 when it comes to the treatment. On the top of that now, remdesivir finally becoming easily accessed now. Even at PMC, we'll be able to get more remdesivir to treat patients. And this is so relieving because in one day I can get the medication and start the medication on my patients who require treatment. And I think this is gonna play a major role. Is gonna be basically a game changer, okay, if you have access to a remdesivir, and if now you're adding to it some sort of steroid, and you have your dedicated ICU team to be able to help with the oxygenation, I think all these elements, they're gonna play a major role in flipping the game and basically providing better care for these patients. And this is basically what we have at PMC. We have all these available, and we be able to help with these patients.
So going back to testing, would you advise some of these larger businesses, people in general, just anybody in the community, to continue to get tested?
Testing is, I mentioned that multiple times, like I know the WHO mentioned about asymptomatic patients that cannot contribute to the spread of the infection. I agree and disagree in a way because you can be pre-symptomatic first and then you can turn into symptomatic, and we've seen it multiple times. So that pre-symptomatic statement, okay, I'm not 100% agreeable with that because, again, you cannot be fully asymptomatic. Some people, they go from asymptomatic to symptomatic, and then once they turn symptomatic, they become definitely contagious. And going back again to the point, this is mainly a respiratory illness, so you need more of these viruses to be shed in the area. And if you cough and you sneeze, you're gonna push massive amount of particles in the environment. And if you're in confined place, you're gonna definitely contaminate people. Now, if you're asymptomatic, you're not gonna cough, you're not gonna sneeze, you're gonna basically breathe and talk, and you still push some sort of particle, but not in the same amount and intensity like when you're symptomatic. But in my opinion, symptomatic or asymptomatic, with some PCR in your nose or in your mouth, you're going to push that in the air. So you're going to push it quicker if you're symptomatic and slower if you're asymptomatic, but both, they're going to contribute to the spread. And for that reason, we say we need to test everybody, symptomatic or asymptomatic. I tested myself several times, so there is nothing wrong with that, because if you want to be really responsible and doing your civic duty, try to be part of the solution. And if I'm sick, I need to contain. It's not right also to see people and take care of patients if you're symptomatic. This is not the right thing to do, because you're going to hurt and you're not going to make any benefit for these people. So be part of the solution and get yourself tested 1 time, twice, 3 times. There's nothing wrong with that. That's why we have the drive-through is dedicated for widespread testing. And that kind of information will tell us how we can gauge the pace of reopening. But again, going back to the point, that piece of information is going to be very helpful, but attitude and behaviors are more important. Because if you want to pick an option, pick the lowest risk option. So outdoors, better than indoor, because better air circulation. It's very well known. If you want to pick a crowd, if you want to pick a group, pick small group, do not pick a crowd. If you want to pick an activity, just exercising outdoor. So all these, like water activity, are healthy. But I'm talking about if you want to do all these activities, keep the 6-foot distance on land or in the water. It doesn't matter if you are anywhere. Keep the 6-foot physical separation. Wash your hands. Put your face mask. All these are going to be very helpful to mitigate the spread. And again, the face mask on your face is an act of strength. This is not an act of weakness, because I hear it all the time, I'm good, I don't need it. It's not for you. It's for the others. If you want to protect the others, put it on your face and help like mitigating the process. So this is basically my recommendation to the public.
Marty, there's been 2 studies I read recently about antibodies. One that said that if people who have been affected, the antibodies stay in their system up to 14 to 21 days, and after that they could be susceptible getting to that. So my first question there is, you know, what's your experience with that? Have you seen that study? And the second study that I read out of UK, where they found that antibodies in alpacas have been positive for helping to prevent and cure parts of the COVID-19. So can you talk anything about that?
So let me touch on the first part about the antibodies. Anytime you're exposed to COVID-19 or any kind of infection, your body is going to mount immunity. And these immunities are having 2 different parts. The acute part, we call the IgM, and the second part down the road is going to be the IgG when you have the convalescent phase. Now, if you look at all the studies from New York, I think they tested at a certain point 12,000 patients. And all of them, they starting to produce immunoglobulin. These production, varies based on the timing of the illness. But at a certain point during the illness, most of them, they went into decent level of immunoglobulin in the system, sufficient enough to protect you from recurrences. I think that's what they're doing now. Anytime we do studies on immunoglobulin, we test them to see what's going to be the efficacy of vaccination. And if you can determine what's going to be the amount of the virus vaccination to be produced and to be given to human, is going to be very helpful for us to determine and to rush and expedite the formation of these vaccinations. So all the studies showing that there's going to be some sort of immunity developed in your body once you're exposed to COVID-19. At a certain point through the disease, these numbers are going to go up to a sufficient levels. Now, nobody knows exactly how long does it last. So if it's going to last 6 months, 12 months, 2 years, we don't know. This is something novel, which is new, and we need definitely more evidence to show us that that immunity is going to be long-lasting or is going to be short-lasting. Now, any immunoglobulin, you can use it for therapeutic purposes. You can take it from human, you can take it from somewhere else, and I think some companies now doing the synthetic immunoglobulin therapy, which means we have some diseases that you can create some sort of targeted antibodies and you try to give it to human. For example, C. diff infection. You get some sort of monoclonal antibodies and give it to people suffering from recurrent C. diff infection. It's the same concept. You create some sort of synthetic antibodies and try to push it to human. And the purpose is to block these, what's called the spikes, from getting attached or anchored on receptors. And by doing this, you inhibiting the key from coming to the lock and stopping all the cascade of inflammatory reactions.
And the second part of that question is, have you heard any
No.
according to what UK put out yesterday, they said that the alpaca antibodies are doing exactly what you said. They're blocking and it's a slippery type of thing which prevents the COVID from sticking to the receptors.
Sure. I think any source doesn't matter. I think the source doesn't matter as long as you be able to come with the right treatment that's safe and effective for human. So we don't care about the source. So we use a lot of animal sources for therapeutic options. So this could be one of the therapeutic options. So it doesn't matter. So as long as you be able to find it safe and effective for human, so I think we'll take it. Everything is welcome at this point to create any positive impact for patients with COVID-19, especially the ones having devastating lung problems.
Tammy, I got a question for you. You mentioned the church and the library in Phelps.
Yes.
Are these 6 new cases directly attributed to that particular church? And what's the correlation between the church, the 6 new cases, and the library?
Okay, I have to be careful what I disclose, but what I can say, no, not all 6 of the last 6 are connected to the church. I'm saying of our 59 cases, 6 have direct links to the Lighthouse Apostolic Church. And looking at all of the cases, we determined it was necessary to go back to June 1st, just from the nature of the activities that we investigated. For a blanket announcement. There is a link between the library and the Lighthouse Apostolic Church as well. And there is a link between the one of the cases that's linked to that church and a case in another county.
Is the link between the church and the library from a patron or an employee, or can't you tell?
I can't tell. Now, that would be getting maybe a little, it's a small library, and as is an extension to, the Pike County Public Library here in
Have
Pikeville.
both those 2 facilities, I think you asked the question, now both those 2 facilities, have they been shut down, and are they being sanitized at this point?
Yeah, we're working with the Phelps Library and then making some determinations. They're working now. I haven't had a chance to meet with the environmentalists. They're here. I've been working with you guys since about 7:30 this morning, and this occurred, the decision and the need to make the blanket announcement regarding the library was made fairly late yesterday evening, but I do know that they're working with them. So more information will be provided about that. But yes, we will obviously recommend decontamination and, things of that nature, and we'll work with them whether a closure, and the length of the closure, what would be necessary.
Are you working directly with the chairman of the board of the library, or who are you working with?
The Miss Allen, we're working with her.
Has the chairman of the board been aware of the situation at the library?
I cannot confirm that. Because I have not had an opportunity to talk to the environmentalist and the nurse administrator this morning. They have not contacted me. But the library director was made aware yesterday late evening that the statement would be made this morning.
And so far, since yesterday to today, nobody from the library board has been in contact with the health department for obtaining recommendations. Is that correct?
Not this morning, but I arrived here at 7:30, and I've been working with the media since 7:30 this morning. So it is possible that they are on the phone with the environmentalist, but I can't confirm that.
Gotcha. Thank you.
Okay. If there are no more questions, what I would like to say is that I'm sure that the citizens are aware that of the 59 cases, there have been all ages affected, from minor children to 82-year-olds. So we've had, all different age demographics, male and female, asymptomatic, to those who are very ill. And unfortunately, we've even suffered 2 losses in Pike County from COVID-19. And I would also dare to say that probably all political and religious beliefs and outlooks have in all likelihood been affected. And I would just like to make a final statement that as the public health director, when I enter the building, and any time that I address any kind of issue that's related to my role as public health director, it is just that and simply that, a public health message. I keep my eye on the public health message, and I relay to you, the Pike County citizens, what is best from a public health perspective, nothing more, nothing less. And I rely on individuals like our liaison, Dr. Margot Riggs. I rely very heavily on experts like Dr. Faudy all across, and also public health experts at the state level as well. And so when we advise you to practice good social distancing and in very specific situations to wear your mask, unless, you know, you're home nesting or at work secluded, you know, we should have our mask on. I have my mask here, I'm speaking, but I'll put it back on as soon as I walk away from the podium. So my message to you is not one from any perspective other than public health perspective. So please listen. I hope everyone has a safe weekend, but, you know, I'm very concerned about the growing numbers. So I felt that, that today was necessary, and I appreciate your time and attention. Thank you.